Vaccines are really one of the most effective ways in which patients can protect themselves from infections. Infections are really a big deal for patients with CLL because it is still a major contributor to morbidity and mortality in these patients. We've learned a great deal from vaccinations in CLL patients specifically over the last couple of years. Traditionally, patients with immunocompromising conditions and patients with CLL have had a lack of information on vaccine responsiveness because they've been excluded from clinical trials. However, since the COVID pandemic, we've learned a lot about how they respond to vaccination, specifically the COVID-19 vaccine, which we know the most about. And even though patients with CLL respond not as much as the general population, they still mount immune responses, both for antibodies and for cellular responses as well. In terms of the COVID-19 vaccine specifically, the vaccine responses in CLL patients overall are about 50%. However, there's a large heterogeneity between vaccine responses within this patient groups. It depends on a lot of factors. The most important one is treatment. So various treatments for CLL do seem to dampen the immune response for patients with CLL. The drugs that are most notorious for this are the anti-CD20 agents like rituximab or obinutuzumab. They blunt the immune response for up to 1 year after therapy. So ideally, patients should get vaccinated before starting treatment or wait at least 1 year after they've received these agents. Another class of drugs that has reduced efficacy are BTK inhibitors. And patients on BTK inhibitors similarly have reduced vaccine responses, and they should ideally also be vaccinated before starting therapy if they can. Venetoclax is another very effective drug for CLL. Does not appear by itself at least to have that much of a dramatic effect in reducing vaccine responses. And the good news is particularly once they get off of therapy, since it's a time-limited approach, these patients tend to have better immune responses compared to before starting treatment as well. I think one important thing to note, even though we've learned a lot in recent years, we still have a long way to go. And we heard from the patient panel today that restoration of immunity is really a key driver, both for patients and really important for physicians as well. We want to see our patients do well. And there's really a need to understand the immune system better in CLL patients, both on treatments and off treatments. And I really look forward to more research in this area in the coming years.